Just as the nation is coming to terms with the dengue outbreak, there appears to be another on the horizon.
Health Minister Dr. Christopher Tufton has indicated that he is on the verge of declaring a flu alert.
He made the declaration in Parliament today, saying infection control programs in hospitals will be enhanced while a public education campaign will be launched.
TVJ's Dashin Hendricks reports.
Doubling efforts to deal with the dengue outbreak, the Health Minister Dr. Christopher Tufton said no efforts will be spared to bring that virus under control, but at the same time, he seems to have his hands full. The flu virus is now gripping the country.
We are bordering on an outbreak of this particular type of influenza, and what it means, we're seeing it manifesting itself in the A&E, where a number of persons are turning up with upper respiratory issues, persons who have to be admitted, which is amplifying the problem of shortage of beds. And so there are probably 8 or 9 hospitals now, looking at the data up to yesterday, where you have 10, 15, 20, 30 persons waiting to be admitted with these symptoms.
The parishes most affected so far are Kingston and St. Andrew, Trelawney, Clarendon, Manchester, St. Elizabeth and Portland. But not wanting to be caught flat-footed with the flu outbreak, the health minister appealed to the public to take precautions.
The flu is to be taken very seriously, as it can lead to pneumonia and blood infections, cause diarrhea and seizures in children. The flu can also worsen chronic medical conditions, Mr. Speaker, such as heart or lung disease.
Persons at greater risk, such as the very young, the elderly, pregnant women and persons with a weakened immune system were warned to take extra precautions. He said the health ministry itself has been proactive.
In preparation for this flu season, a total of some 21,900 doses of influenza vaccines were purchased.
Those are to be distributed free of cost to high priority groups, including children with chronic illnesses, pregnant women, especially those on PATH, persons in state care and health care workers. But knowing it may not be enough, Dr. Tufton encouraged those who can afford to buy the flu medication to do so.
Part of the manifestations of this increasing cases of influenza is the crowding effect in the accident and emergency rooms. And we are seeing many cases of that where persons are waiting with respiratory illnesses to be admitted, but the capacity of these institutions is just not there to deal with the numbers. And so the public will experience some inconvenience over time until we bring the situation under control.
Dashin Hendricks, TVJ News.